Hello everyone, I am Dr. Ramesh Krishnan, Associate Consultant, and in this video I will make you aware about a rare and not very common disorder of a sleep that is called as periodic limb movement disorder.
हमारे यहाँ झंझनाहट
हाँ
चेहरे में पूरा और लेफ्ट साइड में पूरा दर्द
हाँ
और मतलब झटके आते थे रात में सोते हुए।
अच्छा नींद नहीं आती थी और नींद में झटके आते थे।
अच्छा और पाँव में बिल्कुल रात में कभी कभी ऐसा वो हो जाए कि बहुत दर्द होने लगे।
अच्छा
फिर 1 घंटे उसको बैठ के मालिश करें
हाँ
तब जाके धीरे धीरे आराम होता है।
Okay. In this case, patient presents with a leg movements or jerk during sleep. These symptoms are frequently ignored by a common practitioners, and when these patients come to a specialized physicians, a neurologist, then it comes to be a sleep disorder called as periodic limb movement disorders of sleep. This was the patient who came to my clinic who had the symptoms of facial tingling and numbness in his distribution of maxillary nerves. He was presenting with the symptoms that my one side of face is numb and it feel tingling sensation, and I diagnosed it as a case of trigeminal neuralgia in the initial stage. The symptoms get aggravated with chewing, coughing, brushing his teeth. This was the symptoms of the patient, and it is usually diagnosed clinically. The patient was prescribed medication for the same, and the symptoms improved with only a single tablet of the medication which is prescribed for the disease concerned. My patient was also having the symptoms of tingling, numbness in his feet. I prescribed nerve conduction studies which came out to be sensory motor neuropathy. He was prescribed some multivitamins along with the medications for the neuropathy. The symptoms also get improved in a follow-up of 10 days. I advised for SSR study and it showed autonomic neuropathy, though my patient was not presenting with any features of autonomic dysfunctions, though he was presenting with anxiety, restlessness, but not a prominent autonomic dysfunction was noted in my patient. But interestingly, my patient presented with a jerking movement during her sleep.
हमारे यहाँ झंझनाहट चेहरे में पूरा और लेफ्ट साइड में पूरा दर्द और मतलब झटके आते थे रात में सोते हुए।
अच्छा नींद नहीं आती थी और नींद में झटके आते थे।
अच्छा और पाँव में बिल्कुल रात में कभी कभी ऐसा वो हो जाए कि बहुत दर्द होने लगे।
अच्छा
फिर 1 घंटे उसको बैठ के मालिश करें तब जाके धीरे धीरे आराम होता है।
ओके अच्छा, तो आप अपनी बेटी के पास यहाँ पे आए दिल्ली में?
हाँ बेटी हमारी सर्च की और इतना सही इलाज हुआ कि मेरा दिल खुश हो।
He woke up after these jerky movements, and this manifestation was prominent for approx 1.5 months. He might have consulted to a physician or so, was not diagnosed. He came daily to his relatives, visited my clinic, and this came out to be a periodic limb movement disorder of sleep. it is usually diagnosed clinically, and it is a REM sleep behavioral disorders. Though a test called polysomnography is used for diagnosis of these sleep disorders, but it can also be diagnosed clinically. The patient was diagnosed with periodic limb movement disorders of sleep. He was prescribed some tablets, and with a single tablet of the medications for the same, patient improved considerably. He was also having some anxiety, restlessness, but not much prominent. It can be a manifestations of his chronic illnesses that he was suffering from during the course of his illness. During his routine checkup, he was having vitamin D deficiency and vitamin B12, and he was prescribed medications for these deficiencies of the vitamins. So, the message that I want to evoke to you through this video is that he was suffering from facial numbness, diagnosed with trigeminal neuralgia, with neuropathy, with tingling and numbness in his feet. Some autonomic manifestations, but not very prominent, were diagnosed in NCBS study. The very prominent feature in my patient, which was a concern for the patient, was his sleeping disorders with jerky movements during the sleep. He was also having a severe cramp during the sleep. And this was a bothersome manifestations for the patient, troublesome manifestation for the patient. And with a single tablet of the medication which is used for these disorders, patient had a considerable improvement in his jerky movements. It almost disappeared with 1 or 2 tablets which is meant for these disorders. Neuropsychiatric manifestation and vitamin D deficiencies, the patient was prescribed the medications for these deficiencies of the vitamin. So, the message that I want to evoke to you through this video is that do not ignore these symptoms. Do not ignore these symptoms which you are suffering from, and consult to a neurologist, because the simple symptoms that you might be thinking come out to be some rare manifestations if you consult to a specialized physicians, and for me to a neurologist. So, early treatment, early diagnosis, early care will prevent the lifelong disabilities that you may suffer from. So, the final message that I want to evoke to a public is that neurological symptoms are not in your hand. If you are real, they are real and treatable. Early recognition and proper care with consistency can prevent the complications and help you to have a better, healthy and more fulfilling life. So, be aware, get checked, stay healthy, stay strong. The last, I would like to share the message that was given to me by this patient who was suffering from these periodic limb movement disorders. Thank you all for watching my video.